My name is Richard Burke. I'm an Ultra Masters marathoner, and I am a runner by definition.
Richard Burke has been a patient of mine for a couple of years. I first saw him about 2.5 years ago when he presented with pretty severe arthritis in both of his knees. And that was a real problem for him because he has always been an extremely active person who enjoys long distance running. But he has a very high tolerance for pain, so he was able to do that despite the fact that he had bone-on-bone arthritis in his knees.
2 years ago, I had my right knee replaced by Dr. Brooks, and it was with a patient-specific knee replacement.
Some of my patients are candidates for a customized knee replacement. And those patients generally have some specific abnormality or a very misshapen knee or some deformities that would make a standard knee replacement a little more challenging.
It's time for my left one now that needs to be replaced, and same type of procedure with Dr. Brooks and his staff. It'll keep me going for years to come.
And just as he did with his first knee, he excelled with his recovery and his rehab on his second knee.
Just have to really work through the therapy, and especially for me because I want to continue running, my ultra marathon. So
recovery after knee replacement depends on a lot of factors. One of the most important factors is the patient's state of mind, their willingness to work with physical therapy, and their overall physical condition. A knee replacement is known to be difficult for most people, but I've had patients who are not athletes and patients who are athletes do equally well.
My healing is faster. I was out of the hospital the next day, so it's just been great experience. So it's well worth the effort.
We talked about the risks of running long distance, and he's aware of that. Nonetheless, he's been able to return to his activities.
Is it for everybody? I don't know. I don't think you'll find an orthopedic surgeon in the world that would tell you to go out and run again. Definitely, that's what Dr. Brooks mentioned to me. He would probably rather that I don't run, but he knew that I was going to run. He said that he'll do what he can to be able to bring back a lifestyle that I'm used to. I've been running for my whole life, and at 65, I didn't want to stop. I knew that there was still a lot of miles left inside of me. I knew that I was going to be able to compete anymore, but I knew that if I got to the start line, I'd be able to make it to the finish line, and that's what I'm doing. Yeah, I'm back to running, 100%.